This video is about phototransduction. Specifically, it deals with what happens when a photoreceptor is exposed to light. In a previous video, we took a look at what happens to photoreceptors in the dark. In review, we remember that the retinol is curved in the dark. Because the retinol is curved, the G protein is not activated. If the G protein is not activated, the enzyme is not activated. Therefore, cyclic GMP levels can rise, and cyclic GMP can bind to the receptor site on this ligand-gated sodium channel, holding the channel open. When the channel is open, sodium flows into the photoreceptor due to its concentration and electrical gradients. That causes the photoreceptor to depolarize, and as with other cells, depolarization of the neuron leads to an increase in neurotransmitter release. We now want to examine what happens in the light. If a photon strikes retinol, retinol will change its shape from being curved to straightened out. It's the opposite of what we see in the dark. That straightening of the retinol activates the G protein. The active G protein then can activate the enzyme phosphodiesterase. Phosphodiesterase breaks down cyclic GMP, converting it to GMP. GMP does not fit in the binding site of the ligand-gated sodium channel. Therefore, these channels begin to close, making it impossible for the sodium to enter the cell through them. However, there is a potassium channel that we did not talk about in the last video. This channel is open all the time, allowing some potassium to escape. Because there's no sodium coming in, but potassium is escaping, the photoreceptor will hyperpolarize. In summary, when a photon strikes retinol, it straightens out. The straightening activates the G protein. The active G protein activates the enzyme phosphodiesterase. The enzyme then degrades cyclic GMP to GMP. Cyclic GMP does not bind to the receptor site on the ligand-gated channel. Therefore, the channels will close. This makes it impossible for sodium to enter the cell through these channels, but with potassium still exiting the cell, the photoreceptor will hyperpolarize. This hyperpolarization leads to decreased release of the neurotransmitter. This concludes the video on what is happening with phototransduction during the light phase.